The following portion of Live at 9 is sponsored by Memphis Vascular Center. Up to 50% of men between 51 and 60 can be affected by a condition called Benign Prostatic Hyperplasia, or BPH. Dr. Wes Angel is here to discuss what BPH could mean for you and a new treatment at Memphis Vascular. Welcome to Live at 9.
Oh, thank you so much for having me, Kaji.
All right, so let's talk about this. What is BPH? What a name. You know, it sounds complex.
Yeah, people love to name things complex in medicine, and it's confusing terms. It just means big prostate.
Oh, goodness.
So our prostates start growing again for most men in their 20s, and they continue to grow throughout our life. For most of us, we don't notice. We don't have any symptoms. But for about half of men, we can develop some pretty worrisome symptoms, pretty bothersome symptoms, including getting up frequently at night to go to the bathroom, not being able to sit through a movie because you have to wait till the next time you can go, and weak stream, and so it can be a very lifestyle limiting condition for most people. And one thing to take into account is it's not cancer, so it's a benign condition, as the name suggests.
Oh, that's good to know. And so is this something that you can just go on with because you know it's happening to everybody, or is this something where you do have to seek treatment?
It depends. So as always, you should consult your doctor first. For some men, traditionally the treatment has either been medication or surgery. As I'm here to talk to you today about, there's a new kid on the block in terms of surgical options for the treatment of benign prostatic hyperplasia.
Okay, what is it? I'm hanging on the edge of my seat.
So prostate artery embolization, it's an emergence of several different technologies combined to shrink the prostate. And that's the goal, is keeping in mind we have a big prostate that's limiting our ability to go to the bathroom. So our goal is to shrink it. So this is actually a non-surgical treatment. We go in through a blood vessel in the leg using a tiny tube. We take pictures of the blood vessels that supply the prostate and then choke those blood vessels off with some beads. So those beads cause the prostate to shrink over time and produce symptom relief. The typical experience for most people that have this procedure done is they're going to show up about 30 minutes beforehand. This is done in our office, in our outpatient center. The procedure typically takes about an hour to an hour and a half. The most painful part of it is the numbing shot. And then we keep patients for an hour and then they go home. I do this at the end of the week and most patients are back at work by Monday. Okay,
I have to know, what are the benefits? And I think that people who get this are going to want to know, is it going to impact their love life, just to be honest? You know.
So it's a great question, a very question I get asked often in the office. And so the benefits are symptom relief. So I have men who are unable to void without a catheter, who now are catheter free and out there playing golf again. I have patients who can sleep at night that were getting up 4 or 5 times, and so that is the benefit, is the symptom relief. In terms of sexual performance, unlike a lot of the other more invasive options, this has no impact on sexual function. So as I tell my patients, it doesn't tend to work any better than it did before, but it's not going to work any worse.
Oh my goodness. Okay, so how can we contact you?
Absolutely. We'd be happy to see anyone in consultation who thinks that they may have these symptoms at the Memphis Vascular Center, 683-1890. We have a state-of-the-art surgical suite. It is better than most of the suites that you'll find in many hospitals in the area. It's one of the few in the region in an outpatient setting. So we spared no expense trying to have every safety feature available to our patients to take the best care of them we can.
All right, Dr. Wes Angel, thank you so much for explaining all this and keeping it in simple terms for us. And the preceding portion of Live at 9 is sponsored by Memphis Vascular Center.